Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have 3 very special guests today. Joining us, we have Ann Dupree Rogers, who is the Executive Director of Resources for Resilience and a licensed clinical social worker. Joining Ann Dupree, we have MC Ellis, who is the Implementation Specialist with Resources for Resilience and a Clinical Mental Health Counselor Associate. And also we have Jenny Vile, who is the Director of Child Care Resources at Buncombe Partnership for Children and Early Childhood Coaching Consultant for Resources for Resilience. All 3 are resiliency educators for Resources for Resilience, which really in a nutshell means that they are trainers and they do so many very important and special things. And we are excited to have you ladies. Welcome to Pisgah Health Today. We are looking forward to learning a little bit more about your story. And I'll start with you, Ann Dupree. Why don't you start by telling our audience what is Resources for Resilience?
Great. Thank you, Angela. Thanks so much for having us. Resources for Resilience is a nonprofit, a 501c3 that was begun in sort of late 2017 as a response to what we consider the public health crisis of ACEs, or adverse childhood experiences. RFR was founded by a group of individuals from a few different disciplines, but all of which interacted with children and families. We had social workers and counselors and nurses and educators. An Episcopal priest was in the group that kind of began the organization. And really what happened was we first separately and then collectively started learning more and more about the prevalence and impact of ACEs in terms of how many children and families are affected by trauma and adversity, and then realized what can we do about this public health crisis. The impact is so great on families when there's trauma. We started to develop the resiliency tools that we now teach in the Reconnect for Resilience curriculum. So the workshops we started teaching just gained so much popularity. So many people were realizing this is a big part of what communities need, that we were able to form a nonprofit because the demand was there for our work. So that's our story. Since then, since 2017, we have realized that the resiliency tools we teach and the kind of really accessible neuroscience concepts and kind of understanding the brain-body connection, how we're wired both to survive, but also to connect, how we have resiliency, but how we can begin to sort of tap into it more collectively. We realize that it's not just adverse childhood experiences that our tools are really useful in helping address, but then COVID happened and it was the public health crisis of a pandemic. The same tools, the same concepts about what stress and trauma can do to us and how to build resilience and find resilience to those kind of stressors were just as applicable. And then after the deaths of George Floyd and Breonna Taylor and Ahmaud Arbery, all at the end of May, June, it was more than ever the story of racialized trauma and the public health crisis of racialized trauma in this country became another real focus. We were already looking at that, but after the events this summer, that became another kind of real focus. So sort of all these different kinds of trauma affect us. How do we build resilience to them? And here we are doing what we're doing. And then early childhood, in so many ways, there's no better place to start, right, than as early as we can in terms of preventing ACEs when we can, preventing these adverse childhood experiences in the first place. If we can prevent, wonderful. If they've already happened, can we offset the impact of some of those experiences so people find wholeness and well-being even when there's been a lot of adversity? So that's what we do.
As I listen, Ann Dupree, and I think about those ACEs and you describe the public health crisis, I'm not sure that many of us in the audience would necessarily have associated that so very clearly and importantly as what you have done. And then I also think, wow, when I listen to the programs that you have, there's probably something all of us could learn and leverage and use to help be able to tap into and build upon that resiliency as you're describing. So I imagine it's just providing so much meaning in Western North Carolina and beyond. Jenny, let me move to you now and ask, how specifically has Pisgah Health Foundation helped you in serving the community with these resources to help build the resiliency?
So this grant focuses on early childhood, and what we know, right, is that the early childhood field is underfunded across the nation, right? And that it's a very high stress job, right? I don't know the last time any of us spent all day with 12 one-year-olds, but it's on the best day, it's hard, right? And also we know that in North Carolina, 39% of early childhood educators qualify for some sort of public assistance, right? So we're talking about life is hard, right? And all the things that Ann Dupree just said, but then there's more in early childhood, and often really high quality curriculum like the Reconnect for Resilience work can't be accessed just financially by these programs. And so this grant from Pisgah Health Foundation has allowed us to get this curriculum to these teachers, right? To these teachers and some community partners that support early childhood that they absolutely would not be able to access other than this, I mean, without the support of the foundation. And then also to then keep going, right? MC is the implementational specialist, and she's gonna be doing follow-up coaching of like, what does this really look like, right? Because we've all been to trainings that we then go and we go home and we go, well, that was great. And
so what, now what?
Right. So what, now what? And this grant has allowed us to build in that so what, now what with somebody who can be right there with them and say, okay, what can this look like and how can we make this happen? Which is just, it's just so exciting. Yeah.
And part of the grant is also sessions for parents and caregivers, right. So exactly. That we're, the teachers, the educators, those that support young children directly, community partners, maybe a little bit more indirectly, and then parents that, the most important as well. So.
Because what we want exactly is to wrap young children with adults in their lives, right? The important adults in their lives who are all speaking the same language. Wherever they go, they're hitting the same thing. Yeah.
I love, Jenny, that you highlighted RAP when Ann Dupree was describing that, and then bridging back to your comment, I envisioned a circle around these young ones. Yeah. And so you just highlighted that with that picture of RAP along the way. Well, MC, how can the community find more about what's happening, get involved, come alongside and support, be a part of Resources for Resilience?
Absolutely. Come check us out on resourcesforresilience.com. We provide information. We provide videos that have our skills and training. We have Facebook. We have YouTube. We're connected with LinkedIn. So come and join us. And not only we know that you're already a resilient people, right? We're all resilient, especially during the times that we're living in right now. But we want to pull on that resiliency that's already in you and expand that capacity for even more resilience. So yeah, we do a pretty good job of that, as a matter of fact. So come on, join us.
You bring a little energy to the table about doing that as well, MC. I love it. Let me thank all three of you, Ann Dupree, Jenny, and MC. Thank you so very much for taking time to be a part of Pisgah Health today. On behalf of the Board of Directors of Pisgah Health Foundation, let me say thank you to the three of you and the rest of the organization and the volunteers who are partnering with you to bring about so many great things through Resources for Resilience. Yeah. You're definitely serving needs in many, many, many ways. And so thank you so very much.
Thank you, Angela.
Thank you. And to Pisgah Health Foundation, thank you so much.
We look forward to continuing in conversation in the future as we go along the way. So thank you again for being here. We also want to say thank you to Wildflower Media for their technical and creative help, as well as to say thank you to the Board of Directors and staff at Pisgah Health Foundation and the Physicians Roundtable. If you liked and would love to support stories like these and more, let me encourage you, go to pisgahhealthinsider.org and join the movement. Until we see you on the next Pisgah Health Today, stay well and be well.